With a relentless focus on excellence in healthcare, Pullman Regional Hospital presents the Health Podcast.
You know, at some point or another, we've all had an issue with our internal plumbing. Today, we're going to find out about some innovative new technologies to help patients who are experiencing issues with their urinary tract, and I have a feeling it's going to be kind of fascinating. To talk about new urology technology at Pullman Regional Hospital, today we'd like to welcome Dr. John Kaiser, a board-certified urologist at Pullman Regional Hospital. Welcome, Dr. Kaiser.
All right, Deborah. Thank you for having me on your podcast, and excited to be here.
Me too. What a pleasure. So let's dive right in. As a urologist, can you give us a brief overview of what types of problems and ailments you can help patients with?
Well, sure. In urology, we're going to treat anything that really has to do with the urinary system and pelvic floor. So we'll see patients typically with prostate issues, kidney stones, urinary incontinence, but also a wide range of cancers of kidney, bladder, prostate, and testicles. So anything that falls under that umbrella, we're going to take care of.
That's a pretty big umbrella. Okay. So you're using a couple of innovative and new technologies to help our patients. What is UroLift and who does it benefit?
So UroLift is something that we're pretty excited to be able to offer here. It is a very minimally invasive treatment for our patients who have enlarged prostates. So when the prostate gland enlarges in men as they age, it can affect the bladder emptying and affect bladder function. And so UroLift is essentially these compressive springs that we put in that pull open the prostate tissue. So it's very nice because there's no ablative tissue, there's very minimal side effects. And so it's a nice bridge between patients who are on medications but maybe are not doing so well, or maybe they just want to be off the medications, but they're not so symptomatic that they want to proceed with invasive surgery. So this is a nice option for them to do.
Wow, how new is it?
Well, it's been out for a number of years. We've held off doing the procedure here in our area because I wanted to see how it performed. And the studies have shown it's done very well. There's good data that it holds up long term. Majority of patients have good symptomatic improvement with it. And so it's now something that we've now wanted to offer because it has proven itself.
Yeah. Sounds like a wonderful new tool for your tool chest.
It's nice because there's a very minimal side effects, and that's the appealing part of it.
Mm-hmm. Yeah, absolutely. Let's talk about blue light cytoscopy. It's another exciting technology and quite new as well. What does it do and who does it benefit?
Well, blue light for our patients with bladder cancer. So this is a bladder cancer screening tool. And the notorious thing about bladder cancer is that it has recurrences. And I always tell our patients that the toxins they've been exposed to that cause their initial tumor can cause additional tumors to show up in the bladder. And so it's real important to pick these up early when they first arise. And so blue light is a very interesting technology. It's an agent that's put into the bladder ahead of time before we examine the bladder, and the bladder cells take up this agent. And normal cells will take it up and excrete it quite rapidly, but cancer cells take up the agent and then take longer to get rid of it. And this agent will cause these cells to turn bright pink when you examine it under a blue light. So the great thing about this is that when we look into a bladder with standard white light, we may be missing some tumors that we just can't see. But when we do this with the blue light, we suddenly can now see these small early lesions that otherwise would have been missed. And so it's a great technology to give our patients better long-term control and reduced recurrences and a more complete removal of these small tumors.
It does sound like a huge leap forward.
Yeah. So we're really excited about this to bring this in.
So this has been around for a while. Pullman Regional Hospital recently upgraded the Da Vinci robotic-assisted surgery system. What benefits can patients expect from robotic-assisted surgery?
Well, the robotic surgery we like to do because it's more minimally invasive than open surgery. And so our patients have smaller incisions, they're back on their feet quicker, they have less postoperative pain, and just less invasiveness of the procedure. And so we've had the robot technology here for a number of years, but recently have now upgraded to their new machine. which gives us more versatility in how we position the machine to the patient. We can come at different angles. We can do different techniques and different positioning. And it allows us to expand what we can do in a minimally invasive realm. And I think, at least early on, the imaging seems better with the newer system, and the instruments that we can use are a little more versatile to be able to expand what kind of procedures we can do. So we're real excited about this.
Do you do a lot of training when the new equipment comes into view?
I've had extensive training with the older system, and a lot of the surgical techniques are the same with the new system versus the old system. So we have had training, but the training is more involved in the nuts and bolts of the actual machine, of how it's brought in and set up and those kind of things, kind of the technical stuff, but not necessarily training on the actual procedure.
Okay, got it. Dr. Kaiser, why are you so excited about using these new tools with your patients?
Well, all these new technologies just expand and improve outcomes for patients and gives them extra options and choices of how they want to approach things. So it is nice to be able to offer this. I feel very fortunate to be in this area. Pullman Regional Hospital is a small community hospital, but it's really impressive on how they can offer these innovative technologies so patients don't have to travel to other places and they can stay local. And I think staying on the cutting edge, especially in the surgical theater, is pretty important, and it's very helpful for patients.
Yeah, especially if they don't have to travel hours and hours to see their specialists. All these tools and new equipment and new technology, how has urology changed in just the scope of your career?
Urology, when I first started, was worlds different from how it is now. In medicine in general, things change every year. You have to always continually educate yourself to update because everything is different every year. New things come out, new ways of looking at things, new treatments, new medications. When I first started, there was no minimally invasive surgery. It didn't exist. And everything was open surgery and a little more morbidity associated with things. And so it's changed tremendously in that sense that it's less invasive, less pain. We have many more options of how to manage things. When I first started, when somebody had an enlarged prostate, it was either taking a pill or it was doing significant invasive surgery to open things up. And now there's a whole lot of options in between those two steps.
A much, much better day. When I think of my dad, I think about him kicking back with a cigar and JAMA magazine, trying to stay on the cutting edge.
Yes, you can't stay where you're at. You always have to keep evolving.
Well, we really appreciate your time, Dr. Kaiser, and everything you do to help our patients. Thanks so much for being with us today.
Thank you, Deborah. Thank you very much.
And you can learn more about this subject, providers, and services at Pullman Regional Hospital online at pullmanregional.org/urology. This has been the Health Podcast from Pullman Regional. I'm your host, Deborah Howell. Thanks for listening, and have yourself a terrific day.